This is a race against time.
We'll give that a couple of minutes and see if that works.
What I want to make clear is that ketamine is being used in the field as a use of force.
And you still shocking me?
The whole use of ketamine while the police have people restrained is completely irresponsible.
Guess who gets ketamine?
Yeah, seriously.
Just by odds, you are going to have rare circumstances where there are going to be adverse events, and that can include death.
We must remember how many lives the medication has saved.
We've certainly seen ketamine be a very effective drug.
Hello and thanks for joining us for this Problem Solvers Investigative Special. I'm Jeremy Hubbard. For nearly 2 years now, the Problem Solvers have been investigating ketamine and how it's used to sedate people outside of the hospital setting. A coroner couldn't rule out that Elijah McClain had an unexpected reaction to it when he died in 2019 following a rough altercation with police. Since then, it has become a controversial topic and the focus of new legislation right here in Colorado. And Problem Solvers investigative reporter Lori Jane Gliha has been on it.
Yeah, paramedics call this sedative a game changer and a lifesaver that's helped a lot of people. And they say it's one of the safest sedatives available in emergency situations outside of a hospital setting. But our investigation found incidents that make some question whether this drug is always being used appropriately and with adequate training. And though it's extremely rare, some of these cases have ended in death.
I just wish that we could have had more time to talk, or if I could have got her to stay, like maybe it would have never happened and she would be here still today.
Jerica LaCour left behind 5 children under the age of 8 when she died in January 2018. Twin boys and 3 little girls.
I just wish I could have her here again. And I can't. And so I can only imagine how her kids feel.
What's going on, ma'am?
The Problem Solvers obtained this video of her final moments through an open records request. Sheriff's deputies found her intoxicated in an El Paso County truck yard. She wore torn pajama pants and a short-sleeved shirt in the chilly January weather as she hysterically screamed and cried about her children.
I just want my kids.
Okay, what are your kids' names, Jerica?
We obtained sheriff's records that show medics gave Jerica a shot of ketamine to calm her down. And body camera footage captured audio of someone on the scene taunting her about it.
Guess who gets ketamine?
Yeah, seriously.
Paramedics administer the drug under a special waiver from the state and oversight from a medical director, since it's not in their traditional scope of practice. State guidelines show the drug is effective for the treatment of extreme or profound agitation, but it's also associated with a significant potential for complications. Our investigation found medics administered ketamine for agitation in 265 cases in 2018. In 5.28% of those cases, the health department says there was one or more complication that may or may not have been related to the ketamine administration. In 2019, there were 454 ketamine administrations, with 24% having complications. In an email, the state health department told us the data was collected the same way both years, but the complication rates for 2020 are not available because analysts haven't finalized the data. A police document shows Jerica LaCour, who had alcohol in her system, stopped breathing moments after she received ketamine.
Nobody could tell me what happened. So for these 3 years, we've had no closure up to what happened.
Jerica's mom, Rebecca Blanchard, still has questions about her daughter's death. An autopsy report shows she died as a result of respiratory arrest associated with acute alcohol and ketamine intoxication, with other contributing factors. The Problem Solvers asked the state health department whether they thoroughly investigated Jerica's case in 2018. They told us all deaths must be reported to the state, but they have no record of a report involving the death or complication involving someone by Jerica's name. But after the problem solvers asked about her case, the health department said, because of your inquiry, we obtained additional information and opened an investigation.
Losing Jerica put a big damper on our family, and if this case can save a future person, I would love that. And that's what Jerica would want, to save another life.
The problem solvers find another death nearly 3 years after Jerica's.
It was kind of hard to hear that the people you had called to try to help him was the cause of his death.
And why some emergency medical providers say the drug is actually helping more than it's causing harm.
Hopefully he's in a good place now. He wanted everybody to go to heaven, not just those that believe certain things, you know. So he was just good heart.
Hunter Barr was a good soul who would help anyone with anything, according to his dad, Mark Barr.
He was just a really good guy, and his friends say the same thing about him.
Hunter dabbled in drawing self-portraits and taught himself to play the piano. As a little guy, he'd ride all the roller coasters.
I think he's in heaven.
I'll go taser.
In September 2020,
You got taser?
Hunter started acting strange after consuming cough suppressants and the psychedelic drug LSD. So his dad called 911 for help.
What's he on?
Video shows a lethargic, skinny 26-year-old being handcuffed, occasionally grunting expletives.
Oh yeah, this is
But an ambulance report refers to Hunter as a very combative patient and says medics decided to give ketamine to prevent Hunter from hurting himself. He went from this condition to this.
He's snoring now.
I'm gonna pull this out, bud. Okay. So we'll roll him that way.
Yeah, roll him towards me.
Okay. 1, 2, 3.
Clear his mouth as we can.
About 3 hours later, he was dead. His death certificate and an autopsy blames toxic effects of ketamine in the setting of the LSD and cough suppressants Hunter consumed.
I read things that ketamine is good for certain things, but sometimes when it's intermixed with other drugs, it's not.
Ketamine-related deaths are exceptionally rare, and there are only a few unique circumstances where we typically see them. In the majority of the time that you do see significant effects of ketamine, it's almost always in the setting of other significant drugs.
Dr. Leon Kelly is the chief medical examiner in El Paso County, where Hunter and Jerica LaCour died. He did not conduct either person's autopsy, but explains why the drug that medics refer to as an important life-saving tool can be complicated, especially when combined with other substances and complex circumstances.
All medications have the potential to be toxic. In a hospital setting, we have the advantage that the anesthesiologist can sit, they can meet with the patient, they can talk about adverse effects that they've had in the past. In an outside hospital setting, particularly in an urgent critical type situation, you don't have that opportunity. The person may not be in a mental state where they can even carry on that type of conversation. We can't fool ourselves and think that ketamine is some sort of magical drug that never causes problems. That's not true.
The state health department told the problem solvers medical directors have only reported 2 deaths related to ketamine administrations since the state issued the first ketamine waiver in 2011. But they currently have 5 open investigations. A recent study of more than 11,000 people who received ketamine in a pre-hospital setting for various reasons found mortality was rare. But the study included 3,795 patients who got the drug for behavioral reasons like agitation. And in 23% of those cases, patients suffered decreased respiratory rates after getting the drug. That's a serious finding, according to Dr. Brent Myers, one of the researchers.
It's significant enough that we really should be monitoring these patients very closely. So we really need to think about, are we giving our medications for the right reasons, for the right indications, to the right patients?
It's critical that we examine these cases where death and consequence, negative consequence have occurred. That's the only way we're going to do better later.
While death linked to this drug is very uncommon, for Mark Barr, any death is one too many.
He was just a good guy.
You guys can't give him anything, can you?
We can give him ketamine and he'll be sleeping like a baby.
What I want to make clear is that ketamine is being used in the field as a use of force.
The new legislation headed to the governor's desk that has emergency medical providers concerned about the future.
Just drive it right behind his ear if he fights, all right?
When Elijah McLean died in 2019, a coroner couldn't rule out a bunch of things as potential reasons for his death. The autopsy says McLean could have had an unexpected reaction to ketamine, but a coroner couldn't say for sure. The problem solvers were already investigating the drug and uncovering other cases in which some question whether it should have been administered at all.
Are you still shocking me?
The problem solvers were first to uncover this 2019 incident involving an intoxicated Elijah McKnight who ended up on a ventilator. The state health department found no reason to sanction the providers in the case.
Why are we allowing this to happen in our communities?
But State Representative Leslie Herod felt something wasn't right after she learned what we uncovered.
You really put this on the national map, and you have given us the momentum that we need to make some real changes.
She teamed up with other state legislators and introduced a bill to change the way ketamine is administered in Colorado. The General Assembly adopted it in June. The next stop is the governor's desk. It limits the circumstances in which the drug can be used if law enforcement is present. It requires medics to more thoroughly assess a patient's weight before administering the weight-based drug. It adds more diverse experts to the council that recommends which medics can have access to ketamine. And it penalizes law enforcement agents who unduly influence medics to administer the drug. Similar to this situation we uncovered in our investigation.
You guys can't give him anything, can you?
We can give him ketamine and he'll be sleeping like a baby.
I followed your coverage and appreciate you focusing in on this issue and I think shedding some light on it in a way that others haven't.
Colorado Congressmen Joe Neguse and Jason Crow also introduced similar federal legislation. Their bill would ban medics from using ketamine during arrests or detentions for federal offenses.
We must remember how many lives the medication has saved.
But some medical professionals say they believe ketamine is getting a bad name, and they say it's actually doing more good than harm.
It's a challenging topic for us, mainly because it's so important. It's so important that we are able to remain in control of what our protocols are, let our medical directors, use best practices to develop those protocols and best serve our patients that way.
Scott Scholes is the president of the Emergency Medical Services Association of Colorado. He says the sedative prevents people from hurting themselves and has actually saved lives in very serious situations when a patient is truly out of control.
We have a responsibility for trying to prevent them from harming themselves.
Our investigation found 93 agencies in Colorado have waivers to use ketamine on agitated people. State guidance says ketamine should be considered when a patient exhibits extreme or profound agitation, and EMS providers should not engage in restraining people for law enforcement purposes. But each agency develops its own medical protocols, and our investigation found each seems to interpret extreme agitation slightly differently.
During this, I've seen that I think some agencies may be more aggressive with how quickly they get to stronger sedatives, and others that are slower.
Scholes says that inconsistency has created some confusion for the public. But ketamine, he says, is not the problem.
I can see how the public would see, well, if one agency treats this patient in this way and one does it differently, it looks like somebody's got to be doing something wrong. And that's not necessarily the case.
I think the medical community needs to be held accountable.
Attorney Anita Springsteen says there is not enough oversight or training. She believes medics are administering ketamine too often to people who simply have a conflict with police.
I'm not going to be any problem, period.
That includes Springsteen's boyfriend, Jeremiah Axtell. Paramedics sedated him after he was in a verbal altercation with his neighbors in 2020.
I'm gonna go in.
And in 2019, a paramedic sedated her client, Stephen Raycraft, with ketamine after police detained him for a misdemeanor traffic violation when he failed to hand over his ID.
All this other stuff.
I think his case is a very good example of the misuse of ketamine.
Was this administration of ketamine appropriate under our current state guidelines?
Yes, I believe that it was.
Scholes says paramedics are trying to prevent harm to themselves and to patients. He says there's room for better training, and he encourages his team to review videos like these. But he says the videos don't always show the paramedics' perspective or what they knew when they arrived on the scene.
What we've been seeing with this issue are some highlighted patient care issues that I think have been presented often in a way that has created some misunderstanding, but also some opportunity to explain to the public, and maybe some opportunities to improve how we do things as well.
Why the state health department hasn't interviewed with the problem solvers about this since 2019.
We've certainly seen ketamine be a very effective drug that has probably saved a number of lives.
This was an interview from 2019, the last time an official from the state health department agreed to answer questions during an on-camera interview with the problem solvers. Back then, the health department's emergency medical services division director, Randy Kirkendall, told us one reason the state requires medical directors to have ketamine waivers is so they can be monitored.
In addition to how the drug actually operates or how it performs in the field, we're also watching for any errors in administration, which indicate that staff or the personnel are not being able to keep their skills up.
While protocols and quality assurance are handled at a local level, the Colorado Department of Public Health and Environment oversees the ketamine waiver program, and Kirkendall says it doesn't want to see complications rise.
If we do see that start going up, then it begins to question the efficacy of either the drug, the training, how it's being used.
But as we told you earlier, the number of complications the state tracked, whether proven to be directly linked to the ketamine administration or not, did go up between 2018 and 2019.
We do not have a proper enforcement mechanism or real impartial regulation.
We've been trying to get more answers from the medical agencies that make decisions about this, but over the last year, local agencies declined or backed out of scheduled on-camera interviews. The problem solvers made at least 19 requests in writing for an on-camera interview with state health leaders, but every time they denied or ignored the request. In August 2020, the state health department said it would conduct a review of how ketamine is handled in Colorado. It even put out this press release saying the review will begin immediately. But our investigation, which included open records requests and a search through internal state health department emails, found that review didn't get off the ground until 2021, and the people now investigating the state's policies and guidance are doing it away from the public eye.
I'm a little bit distressed that this is taking so long because we are fully in the throes of lawmaking on this issue, yet we have not fully vetted these tragic cases, nor have we fully vetted the use of ketamine statewide.
House Bill 1251 is repassed as amended.
With or without comment and information from the health department, Colorado's new ketamine law goes into effect when the governor signs it, and it will directly impact Colorado's current ketamine program. Plus, the American Medical Association, a national group, adopted a new policy saying ketamine should not be used to sedate agitated people solely for law enforcement purposes. And the AMA says the extremely agitated condition many in Colorado have referred to as excited delirium is not a legitimate diagnosis or medical reason to give the drug, even though the state approved many agencies' current protocols which use that term. Instead of an interview, the health department gave us this statement. The Ketamine Investigatory Review Panel has not yet completed its work, so CDPHE will not comment.
And again, that review was announced about a year ago, and we're still waiting for results.
We know you'll give us an update if you eventually get one. We certainly thank you for staying on top of this story and for all of your reporting. And on behalf of Lori Jane and the entire Fox 31 News team, thank you for joining us for this Problem Solvers Investigative Special.